Hello, my name is Michiko Smith, currently attending the Edson College of Nursing and Health Innovation at Arizona State University. This is Nursing 318, Nursing Research and Evidence Translation with Dr. Kathleen Fries. The topic of my evidence-based practice final presentation is skin-to-skin contact in breastfeeding. Skin-to-skin contact involves placing a newborn baby on their mother's bare chest, with a blanket covering them both to keep them warm. This practice has been shown to have a number of benefits for both the baby and the mother. For the baby, skin-to-skin contact can help regulate their body temperature, heart rate, and breathing, and can also promote bonding with the mother. For the mother, skin-to-skin contact can help regulate her hormones, reduce stress, and promote the release of breast milk. Skin-to-skin contact is often interrupted or delayed due to a procedure like a mom having a cesarean section or nursing tasks like taking the baby away to get a vitamin K shot or a transport of the mother from one room to another. There also seems to be a lack of breastfeeding education, support, and encouragement from staff and family members, and also the pressure to bottle feed formula if family or staff feels like the baby is not getting enough to eat. My PCOT question is, in women of childbearing age, what is the effect of immediate skin-to-skin contact in comparison to delayed skin-to-skin contact on exclusively breastfeeding in the first 3 months of infant's life? Population would be women of childbearing age. Intervention is the immediate skin-to-skin contact. Comparison is the delayed skin-to-skin contact. Outcome is exclusively breastfeeding, and time would be first 3 months of infant's life. The search strategies that I use for both articles, I use the ASU One search engine. I use skin-to-skin contact and breastfeeding without any parameters, and I saw 1,013 articles. I then put parameters to the article, such as peer-reviewed, full text online, open access, peer-reviewed journals, and then I limited the search from 2017 to 2022, and the results were 355 articles. Upon my last search, where I added the Boolean connectors of infants, newborn, skin, breastfeeding, and the word quantitative, the results were 4 articles. Article 1 was a quantitative quasi-experimental design study, and it was a study that was conducted back in 2019 in a large tertiary maternity public hospital with randomly selected 102 mothers and newborns. Independent variable were 51 mothers and newborns whose mother had an elective cesarean birth and or immediate skin-to-skin contact. The dependent variable was the 51 mothers and newborns who went through a elective cesarean birth but had delayed skin-to-skin contact. The limitation of this study was there was only one hospital, so the study was kind of limited because they considered it stereotypical, and skin-to-skin contact sometimes did not immediately occur at birth and was delayed up to 5 minutes or interrupted for a transfer of the mother. The chosen article was exploring outcomes for women and neonates having skin-to-skin contact during cesarean birth. Article 2 was a quantitative design, but it was a cross-sectional study. Looking at a study that was conducted in 2018, there was 86 co-ed infants in the NICU of a high-risk maternity floor. The independent variable were 48 infants who received skin-to-skin contact at least 8 hours per day. The dependent variable was 38 infants with no skin-to-skin contact because the mother was either not willing to participate or was not present to do so. There also was a limitation to this study that there was only one hospital in the whole state for high-risk pregnant women and preterm newborns. The chosen article for this study was weight gain in newborns submitted to skin-to-skin contact. The findings were very similar in both articles. According to Article 1, the study by Sheedy et al., independent t-test revealed that there were significant differences between the two groups regarding the timing of the first feed, with the first breastfeeding results presented in minutes. Article 2, in this research, study by Souza et al., 2018, physical contact between children and mothers establishes an effective bond between both of them, enabling skin-to-skin contact between mothers and infants and to promote breastfeeding. So my proposed implementation to the staff would be staff meetings, unit in services, collaborate with clinicians, recognize success, barriers, and/or solutions, sharing the protocol revisions with clinicians for individualized feedback, and then we will celebrate local unit progress with the incentives, and that's kind of keep the staff engaged in this process. So, as far as clinical expertise, I would utilize the staff that I had around me, like my clinical experts such as lactation consultants, labor and delivery nurses, midwives, clinical nurse specialists, which are usually your leaders on the floor, NICU team members, physicians, and certified nursing assistants. I believe anyone who comes in contact with the patient can play a part in the education and support of a mother having skin to skin without interruptions, and also support with the initial breastfeed. I would then form a clinical team with voluntary participation, so we could collaborate and go over clinical skills, and we could figure out who has expertise in what area, and then we can all come together and use that information. The patient would be included as voluntary participating in this study. The data would be gathered from either email with staff and in a survey form to ask well-worded clinical questions for evidence-based practice, such as, what are your expertise? What is your role in the hospital? This would be for our clinicians. As far as for patients, I would give an informational brochure. It will be voluntary, of course. And there will also be a pre and post survey for the patients. As far as communication and marketing, I would offer the patients brochures about the study with information included in that brochure about the study at the time of admission. We could also put information in the hospital newsletters to the surrounding community to let the community know what this hospital has to offer. How is it different from other hospitals? The fact that we would, try to implement that uninterrupted skin to skin contact and what that would promote for the mother and the baby. Also, television advertisements as far as commercials that would market what the hospital will offer is for the labor and delivery floor. Free birthing classes. I feel like you can educate mothers then, even before they have their babies, on skin to skin contact, and also breastfeeding and the importance of it. So my proposed practice change would be to implement the early skin-to-skin contact with uninterrupted time for mother and baby to initiate breastfeeding for a minimum of 1 hour prior to any assessment or care. As far as the evaluation, there will be a written record by the primary nurse or midwife of skin-to-skin contact from birth until discharge and initial breastfeeding. Postnatal questionnaires will be given to the patients if they're willing to participate prior to discharge and recorded by the expert clinician would be the primary care nurse or the midwife. And the goal of this implemented practice would be, or evidence-based practice would be, to increase incidence of exclusive breastfeeding with positive outcomes with education and support to mom. Here's my reference page. Please enjoy. Thank you.